So I was curious, I know that there's a conference that I'm really excited to be part of, and thank you for inviting me. I look forward to it, FHLIP.
Yes.
The main stakeholders here is academia and policymakers, and as well as everybody else, obviously, who's interested in the topics and has something important to bring. Tell us about the story of how that started in your mind and where it's going, and what do you want to see achieved through that conference?
Well, I think the first thing I would say is that it's broader than just academia and policymakers. Okay, and I think this is something that I felt a long time ago, that when I was doing my projects or working with patients, one of the things that I realized was that lots of stakeholders in our system sit on the sidelines, especially electronic medical records. I was like, where's the College of Family Physicians? Mm-hmm. Where's the Royal College of Physicians and Surgeons? Mm-hmm. Where's the College of Physicians and Surgeons of Ontario? They were nowhere around, okay? And maybe nobody invited them, or maybe they thought it had nothing to do with them, but it had everything to do with them. And I'm like, why are they not there? It doesn't make any sense to me. And you could see that the choices that were made, that the approach that was taken led people down pathways that were not necessarily conducive to success, long-term success. Okay, and you see that today. Like we see electronic medical records not working, and I'm like, this could have been prevented if the College of Physicians and Surgeons was on board and participating and saying, this is what our needs are. And somebody else could say, this is our needs are, and then you can keep them separate. And the thing is that a lot of it could have been avoided if we had the right people at the table. Mm-hmm. So that was one kind of strain of thought that I've had, that, we need to have more stakeholders at the table. The other thing that, I used to go to a conference in Victoria that's held every other year. It was a health informatics conference. It was so well organized, such an amazing conference. Like, you didn't want to miss a single session because every session was just awesome. And the people that were there were just amazing as well. So it was just a fantastic conference. And I'm like, we need something like this in Toronto. And so I've had that idea of that we need this conference here in the East, just like there's one in the West. And I thought, we could have one year there, and every other year we can have it here. So, so that was an idea that was percolating for me for a while. And then in 2017, one of the things I realized is when I went to the conference in Victoria, that I said to myself, we need this to be more policy focused, because we're talking amongst ourselves, and you can't be successful when you just talk amongst yourselves.
That's
you
right.
create a little echo chamber.
Yes.
Right? I said, no, we need to open that up. And so when I became the program director here, I started to think about that. But it wasn't like a main line for me. But as I was starting to look at the program itself and saying, how are the students of the program going to influence the world, right? They need to influence the world. They need to be at the table. Their ideas need to be brought forward. How do we create that opportunity for them? And that's how FHLIP came about. So I said, well, we should have a conference where our students can present and give them an opportunity to showcase what they've learned, but in a much more rigorous and much more credible way than they would doing a class project.
Okay.
So then I said to myself, so that's an opportunity for the students, but I said, they can't influence in a vacuum. So we need to have all the stakeholders there. So you'll see that, there's quite a few media people there, like yourself, and there's others, but there's also patients. So I have several patients who will be there on that day. I have the Ontario Medical Association, the Ministry of Health. Yeah. I have vendors will be there. Vendor representatives will be there. And we have lots of other people, lots of academics, okay, because this is their kind of, but even academia is very broad these days.
Yes.
It's not like only universities. We have academics who work at the hospitals, academics who work at the Vector Institute. So you'll get a chance to meet a lot of different people who all have an interest in the healthcare system. And I'm saying, let's all get together.
Yes.
And let's work together.
Beautiful.
And that's the whole purpose of FHLIP. It's just, and let's make it in a neutral location and a neutral venue where everybody can have a debate, can have a conversation in a psychologically safe space, so that we can all have a conversation and say, yeah, this is a great idea. How can we move it forward? This is not such a great idea because of such and such.
Got it. So debate focused.
Debate, discussion, collaboration, co-design.
Co-design. Awesome. I love it.